would like to turn off your camera, please feel free to do so. Our guests for today are Jarita Walker, Public Affairs Specialist with the Social Security Administration, and Adid Zafirin. She's an Outreach Specialist with the Center for Medicare Services. We will start with Jarita, and I will turn it over to you for your presentation. Jarita, take it away.
Good afternoon. I would like to first thank Office of Congressman Malinowski staff for allowing me to speak this afternoon. I will be pretty much just giving you an overview of the Medicare enrollment. So as of now, I'm on the first slide. I would like to move on to the next slide, which talks about Medicare. Just let me know when you're there and I'll begin talking.
Yep.
Okay. Medicare is our country's health insurance program for people age 65 or older. People younger than age 65 with certain disabilities or permanent kidney failure or who have Lou Gehrig's disease can also qualify for Medicare. You have choices for how you get Medicare coverage. Medicare has 4 parts. Part A is hospital insurance, which covers most inpatient hospital expenses. The 2021 deductible for Part A is $1,484. Part B is medical insurance, which covers 80% of doctor's bills and other outpatient medical expenses after your first $203 in approved charges. The 2021 standard monthly premium is $148.50. There is no monthly premium for Part A if you are insured for retirement benefits. After you retire, your health insurance may require for Medicare to pay first. Many supplemental plans require you to sign up for Medicare Part B. The Medicare premium most beneficiaries pay represents a quarter of the actual cost, and the federal government covers the balance of the cost. Medicare Advantage, also known as Part C, is an all-in-one alternative to original Medicare. These bundled plans include Part A, Part B, and Part D. These plans may also have lower out-of-pocket costs and may offer extra benefits that Medicare doesn't cover, like vision, dental, and more. Part D is Medicare prescription drug coverage, which covers a major portion of your prescription drug costs. Your out-of-pocket costs, monthly premiums, and annual deductible and prescription co-payments will vary by plan. You enroll with Medicare approved prescription drug provider, not by contacting Social Security. Each Medicare Advantage plan can charge different out-of-pocket costs, but they must follow rules established by Medicare. Medicare approved prescription drug plans cover a major portion of your prescription drug costs. I'm going to move to the next slide, which is the Medicare eligibility. And just let me know when you're there and I'll begin talking.
Yep, we're there.
Okay. Remember that although the full retirement age has increased above age 65, Medicare eligibility is still age 65. One of the most important things to remember is that you can apply for Medicare online even if you are waiting past age 65 to apply for Social Security retirement benefits. You should apply for Medicare 3 months before your 65th birthday, even when you plan to apply for your retirement or spouse's benefits later. If you are approved for Social Security disability benefits, you will be eligible for Medicare benefits 24 months from the month you were entitled to receive benefits, not from the first month you receive a payment. If you were diagnosed with Lou Gehrig's disease and you get disability benefits, you can get Medicare right away. If you have permanent kidney failure and you receive maintenance dialysis or a kidney transplant, you can also be eligible for Medicare. And Medicare, you can also be eligible if you have been exposed to environmental health hazards. I'm going to move on to the next slide, which talks about Medicare enrollment.
Yep, we're here.
Okay. Medicare has 3 enrollment periods. Number 1 is the initial enrollment period. This is a 7-month period that begins 3 months before your 65th birthday, includes the month you turn age 65, and ends 3 months after that birthday. Second is special enrollment period. If you are age 65 or older, you or your spouse are still working and you are covered under a group health plan based on that current employment, you may not need to apply for Medicare Part B at age 65. You may qualify for a special enrollment period that will let you sign up for Part B at the time you retire without a penalty for delayed enrollment. Last but not least, general enrollment period. If you didn't sign up for Part A and or Part B when you were first eligible and you aren't eligible for a special enrollment period, you can sign up during the general enrollment period, which is January 1st through March 31st each year. Coverage does not begin until July 1st. You may have to pay a late enrollment penalty for as long as you have Part B coverage. You can file for Medicare if you are delaying cash benefits, and you should not contribute to a health savings account if you are enrolled in Medicare, as there may be negative tax implications. We're going to move to the next slide, which is Medicare Part B.
We're here.
This chart shows you when Medicare will become effective if you apply during your initial enrollment period. If you apply during the 3-month window prior to the month you turn age 65, your Medicare kicks in the first day of the month you reach age 65. And as you can see, it goes on for the month after the month you reach age 65 and 2 months and 3 months. We're going to move on to the next slide, which talks about Medicare Applications.
Yep, go ahead.
Okay. You can use our website to apply for Medicare Parts A and Part B along with Social Security retirement benefits. Most people apply for Medicare Part A along with their retirement benefits because you are required to enroll for Medicare Part A at the same time you start retirement benefits. Medicare Part A has no monthly premium for those who have 40 work credits. If you apply online for Medicare Part A only and refuse Part B, which does not have a monthly premium, you can enroll in Part B later after your employer group health plan coverage ends. If you are already in Medicare Part A and later you add Part B under the special enrollment period, you have 3 options. You can visit the website to complete the online application. You can also fax your completed CMS 40B form, application for enrollment in Medicare, which is the medical insurance for Part B, and the CMS L564 request for employment information and proofs to your local Social Security office. But lastly, you can also mail your completed forms to your local Social Security office. After the presentation is over, I emailed some resources which has all of these forms and publications available to you, which will be shared after the presentation. The next slide is the extra help with Medicare prescription drug plan costs.
Yep, we're here.
Okay. Extra help is available for beneficiaries with limited resources and income to help pay for the costs related to a Medicare prescription drug plan. These costs include monthly premiums, annual deductibles, and prescription co-payments. Extra help is estimated to be worth about $5,000 per year. You may apply for extra help online, over the phone, or after contacting your local Social Security office. I'm going to move to the next slide, which is the Medicare Standard Part B premiums for 2021.
Yep, go ahead.
Okay. This graphic shows the Medicare premiums for each income bracket. Most Medicare beneficiaries pay the standard premium for Part B, which is $148.50 a month for 2021. It is automatically deducted from the Social Security check if they receive one. If not getting a check, they can be billed or have the premium deducted from a checking or savings account. People with higher incomes will pay more for Part B and their prescription drug plan premium. This is called IRMA, Income Related Monthly Adjustment Amount. We determine whether you pay the higher premium every year. To decide your IRMA, we ask IRS for your modified adjusted gross income, which is the MAGI, that equals your adjusted gross income plus certain tax-exempt income from the federal income tax return you filed 2 years ago. For example, your 2020 Part B premium is determined by your modified adjusted gross income on your 2018 tax return. If your 2018 tax return is not available, we will use your 2017 tax return. You should not contribute to health savings account if you are enrolled in Medicare, as there may be negative tax implications, but you can contact your tax professional for more information. I'm going to move on to the next slide, which is the Medicare card.
Yes, go ahead.
Okay. New Medicare cards have now been sent to all Medicare recipients. Old cards with Social Security numbers will no longer be accepted. If you don't have a Medicare card, you can call the 1-800-Medicare number. And as you can see, the Medicare card has what we call the Medicare Beneficiary Identifier, which is a combination of numbers and letters, which can be cross-referenced with your Social Security number. We're going to move on to the next slide, which is Medicare.gov.
Yes, we're here.
Okay. Please keep in mind that although you apply for Medicare by contacting Social Security, we have some Medicare information on our website. It is actually another federal government agency, Center for Medicare and Medicaid Services, commonly referred to as CMS, that administers the program. CMS is your main source for information regarding Medicare. Social Security helps you apply for Medicare Parts A and B, and we send you entitlement information electronically to CMS. We can also take your application for extra help with Medicare Part D. If you sign up for Part B, we deduct the premium from your monthly Social Security benefit and send it to CMS before you receive your payment from us each month. If you enroll in Medicare only, CMS will bill you for your Part B premiums until you go on Social Security. If you have questions regarding the Medicare program, you can call CMS at 1-800-Medicare or visit Medicare.gov. Your state health insurance assistance program, which is SHIP, can help answer any Medicare questions you may have. You can get the phone number from your local SHIP office, visit their website, which is shiptacenter.org, or look in your Medicare and You handbook. For more information about Medicare, please visit Medicare.gov or call the 1-800-Medicare number. And I'm going to move to my last slide, which is my name, my title, my phone number, and my email address. Like I stated, after the presentation, there will be some Medicare resources shared with every participant in reference to the presentation. But if you have any detailed questions, you can always shoot me an email, and I'll be more than available to assist you with any questions. Thank you for allowing me to present to you this afternoon.
Thanks so much, Jarita. That was, thank you so much. We are now going to move on. We're going to move on to Adine from the Center for Medicare Services. Adine, our staff is able to share our screen and get your presentation up.
Thank you.
Just give us one moment.
Good afternoon. My name is Adine Zephyrin, and I am from the Centers for Medicare and Medicaid Services. I am an outreach specialist. With me on the line today, I have my colleague, Thomas Bain. and he will also be available to answer any questions at the end of this presentation. First, I want to thank the office of Rep. Malinowski for inviting us today. So we're gonna go ahead and start right away since we are pressed on time. And the next slide, please. Today we're gonna start talking first with Medicare Part D. And the reason for that, it's because Medicare Part D, you can have Medicare Part D if you have what is called the original Medicare, which my colleague from SSA just covered. That means Medicare Part A, you can have Part D. If you have Medicare Part B only, you can have Part D. So this is why we're gonna start with Part D instead of Part C. So next slide, please. Part D is Medicare coverage. It's an optional benefit. And the reason we say optional is you don't have to have it if you don't want to. But it is available to everyone who has Medicare. And as I said before, if you have Medicare Part A only, you can purchase Medicare Part D. If you only have Medicare Part D, you can also purchase Medicare Part D. Part D is coverage that's provided to the Medicare drug plans and Medicare Advantage plans with drug coverage. Another name that you might hear is Medicare, it's MAPD, and all it means it's the Medicare Advantage plans with drug coverage. You can also get Part D coverage to other Medicare health plans, including the PACE program, which I will cover shortly. However, each type of plan has special rules and exceptions. So if you want to purchase it, you have to contact the plan that you're interested to get more details. The next slide, please. How Part D works. As I said, you can choose a plan and you join it. The only thing about the Part D, even though it's optional, I know it sounds funny, but even though it's optional, you still have to purchase the Part D when the time comes. Because if you don't, then you might end up paying a lifetime penalty if you join late for the Part D. Also, the plans have the formularies. It has the list of covered drugs. You have out-of-pocket costs. You also, if you have limited income and resources, there is such a thing called extra help to help you pay for the Part D cost. The next slide, please. Each plan has their own costs. So when you speak to the plan that you've chosen, then you will find out what the monthly premium is, what the yearly deductible, your co-payment, and your co-insurance will be. But it all depends on the plan, and the plan will vary depending on which plan you choose, and it depends on the area of where the plan is located. The next slide, please. My colleague from SSA mentioned something called IRMA, and that was about Medicare Part B. Medicare Part D also has an IRMA, and it's pretty much the same idea behind it. If you are higher income, you will be paying a little bit more for the monthly premium for your Part D. That's pretty much all it means. Just like Part B, Part D, if you're higher income, you pay a little bit more for your monthly income, monthly cost. Next one, please. The Part D late enrollment penalty, as I mentioned earlier, if you do, did someone have a question?
We'll go into live questions after your presentation.
Okay, so we're going to talk very briefly with the late enrollment penalty. All it means is that if you do not enroll when you were supposed to, you might end up paying a late enrollment penalty. And that penalty will be pretty much a lifetime penalty. So there are exceptions as with everything else. If you have creditable drug coverage, you will not be paying that late penalty. If you have extra help, you will not be paying that penalty. What is creditable drug coverage? It means that you did have drug coverage from your plan and it is of the same value or higher with from the Medicare Part D. So if you had that, you will not be paying a late penalty. And extra help is exactly as the name says, you get extra help to pay for your drugs. If you have that, you also will not be paying for the penalty. Next slide, please. Who can join Part D? As I said in the beginning, if you have Part A, you can. If you have Part B, you can. And it's also part of the Medicare Advantage, which is Part C, which I'm going to cover in the next few slides. Next slide, please. When can you enroll in the Part B plan? You can enroll during the 7-month initial enrollment period. All it means is that during the yearly open enrollment period, which is what we are going through right now. From October 17 to December 7, you can enroll for any Part D plan that you choose, and the coverage will begin next year, January 1st. The next slide. Should you enroll in a Part D plan? This is a decision that, of course, you would have to make. But the only things you should keep in mind are what I said earlier. If you had creditable drug coverage and you want to enroll in the Part D plan, you will not be paying a late penalty fee. The only thing I would say you need to absolutely keep in mind is that if you don't enroll when you should have enrolled, and you did not have creditable drug coverage, or you don't qualify for the extra help, you will end up with a late penalty fee. And that late penalty will be for, it's a lifetime penalty. So should you enroll, that's a decision you have to make, but keep those 3 things in mind as I mentioned. The next slide. Now we're going to move on to the Medicare Part C. The Medicare Part C is, it explains, the Medicare Advantage plan is another way for you to get the Medicare Part A, the Medicare Part B. And so that's why they call it the Medicare Part C, also called Medicare Advantage plans. I've heard people call it different names. I've even heard people call it private Medicare. I've heard people call it Medicare HMO. It all means the same thing. All it means is that you're going to be receiving this, your Medicare benefits through private plans. So that's the Medicare Advantage plans. Next slide, please. So the Part C, as you can see on your slide, you are still in Medicare with all the rights and protections that Medicare provides. You're going to get the services that are covered for Part A, which is hospital, the services covered by Part B, which is your doctors, and the services covered by Part D, which is the drug. So basically, the Medicare Advantage, also called Part C, is pretty much you getting every single one of the Medicare services with one plan. So that plan will be covering all the services you would have gotten if you only had Part A or Part B or Part D. So that's in a nutshell what the Medicare Part C is. The plan, you can choose a plan that includes drug coverage. Of course, you don't have to, but we mentioned Part D earlier. You will be charged different out-of-pocket costs. The reason for that is that each plan has their own costs. You cannot be charged more than the original Medicare for certain services. So what that means is if you had original Medicare only and a certain type of service like chemotherapy would have cost you a certain amount, if you choose to have a Medicare Advantage plan, that plan cannot charge you more than the original Medicare. The next thing you should know is that you can choose a plan that includes extra benefits. That means vision, dental, and fitness, wellness, and so on. Because as you might know, original Medicare, there are certain services that it doesn't cover. Vision and dental are two of them, for example. So with Medicare Advantage plan, when you get that, you might choose a plan that offers all these. It also has a yearly limit on your out-of-pocket costs. So there you're going to know that depending on the plan that you choose, you will have a yearly out-of-pocket cost. The next slide, please. How does a Medicare Advantage plan work? What you should know is that each plan has a service area in which the enrollees must live. And that's very important to remember that part. The service area is when you're choosing the plan, you must be part of the service area of that plan. So this is why the plan that you're choosing, you got to know, first of all, are you in the service area and does it offers all the benefits and services that you're looking for? So you can request to see if an item or a service is going to be covered by the plan in advance. You can do that. Medicare pays a fixed amount for your coverage each month to the company that's offering the Medicare Advantage plan. And each Medicare Advantage plan can charge different out-of-pocket costs. And they have different rules for how you get the services. So for instance, some of them might say you need a referral from your primary care physician in order for you to see any specialist. Whereas some other plans might say, no, you can go see any specialist as long as they are within the network. So it all depends. So that's why when you're going to, if you're going to choose your plan, you absolutely need to speak to someone from the plan or to an advocate or to a facilitator to find out if the plan is going to be a good fit for you. Some of the plans also offer hospice care, and it's covered by the original Medicare. The next slide, please. You can join a Medicare Advantage plan when you first become eligible for Medicare. So what that means is when you first become eligible, when you turn 65, you don't have to first be in original Medicare and then switch to Medicare Advantage. No, you can choose a Medicare Advantage plan as soon as you become eligible to be in Medicare. If you have Part A and you enroll in Part B during a general enrollment period, which is pretty much what we're talking about right now, if you have, during all these times, you can choose a Medicare Advantage plan. You can do it when you first become eligible. You can do it during what we call a general enrollment period. You can do it during a special enrollment period, and so on. So basically, you have the choices to enroll in a plan pretty much at any period that's available to you. The next slide, please. Every year, you're going to have a chance to review the Medicare coverage that you have and then figure out if it's still meeting your needs or not. That open enrollment period is the period we are in right now. This is October 15 all the way to December 7. Once you make that choice, again, it's going to be, your coverage is going to start on January 1st of the next year. The Medicare Advantage allows people enrolled in a Medicare Advantage plan to make a one-time change during the first 3 months of the calendar year. So what that means, very briefly, just remember that you're going to be enrolling in the plan between October 15 to December 7, and it's going to be effective January 1st. From January to March, there is this period where you could change if you were to decide that this plan, as you thought, does not fit your needs. So that is another period where you could change it and go to a different one. The next slide. Yep, right here, please. There are things that you should definitely consider when you want to join a Medicare Advantage plan. You have to have Part A and Part B to join the plan. If the plan offers extra benefits and you need to pay extra to get them. Some plans may require you to use a network. You may need a referral to see a specialist. You must pay the Part B premium and usually a monthly plan premium. Not always, usually. You can only join or leave the plan during certain periods, which I just covered. And the Medicare Advantage plans don't work with the Medicare policies. Next slide. Very quickly, all that means, this slide, is that if you have end-stage renal disease, beginning this year, that's going to be effective next year, you can now join a Medicare Advantage plan. All that means is that before you could not join a Medicare Advantage plan if you had end-stage renal disease. But beginning this year, this is a new benefit. That's a new thing for Medicare. You now can join a Medicare Advantage plan, even if you have end-stage renal disease. And of course, it's going to start beginning, it will be effective beginning January 1st of next year. Next slide. As I mentioned earlier, the PACE program is pretty much exactly that. If the PACE program is considered a Medicare Advantage. It's part of the Medicare Advantage plans. And pretty much all it means is that you can join the PACE program if you are someone who is looking for a whole team to help you manage your life, or manage the life of someone that you know, or that's part of your family. So, for instance, my mother, she is part of a PACE program, and I put her in a PACE program because I needed help in order to manage her health. So that's why I put her in the PACE, and it's been working great for me. So this is something that if you're looking for a team that includes doctors and nurses and physical therapists and nutritionists and so on, if this is what you're looking for. So there is a whole team of professionals that can help you manage your health and your life at the same time while you're living independently in your home. The PACE program is definitely a program you can look it up. The next slide, please. So that's pretty much it for me. The only thing I would definitely mention is that please remember those few things. No matter what plan you choose, it will be effective next year, January 1st. The next thing you should know is that we at CMS, we mail the Medicare in Your Handbook every year during fall, and we send it to every single Medicare household. This year, the Medicare in Your Handbook has been translated in 23 languages. So if you're interested to look at it, you would like to get more information, please go to our website, medicare.gov or cms.gov, and you'll be able to get the Medicare and you download it in the language that you want. The next thing is, I would be remiss not to quickly mention that this is flu season. And remember that Medicare covers your flu shots, your COVID-19 vaccine, and the booster shots, all that at absolutely no cost to you. Thank you. And we would absolutely love your feedback. So I am going to add this link on the chat for you to take our survey. When you're putting the survey, you can put pretty much anything that you remember about this meeting title, but please add the word New Jersey for us. Thank you.
Thanks, Adine. And thanks, Jarita, as well for those great presentations. We are going to begin some live questioning. We'll get to as many questions as we have here today. We do have a few people in the queue. So just a reminder, if you have a question, please first ask your question using the chat feature at the bottom of your screen. When you do so, please include your name and the town you are from. That will help us call on the correct person to ask your question. If you have a question in regards to policy, ways that Congress is working to remedy Medicare negotiations, Social Security benefits, we ask that you please reach out to us via our contact form online. That's malinowski.house.gov/contact. I've dropped that link in the chat feature as well. Again, those are for any questions regarding policy measures for Social Security or Medicare. All right, let's go into some live questioning. We are starting with Deborah from Summit. Deborah, can you hear us?
Yes, hi. My question is about the time to enroll. If you're retiring, my husband and I are retiring as of March 31st, and we have private insurance now. We also each are enrolled in Medicare and have Part A. So with all of this information, I'm looking for clarification because we don't want to have a gap in coverage. And we want to be sure that we are enrolling in a timely and in the proper plan. We don't know. And I have the booklet, but it's hard to special enrollment. And so that's why I'm asking for some insight. That's my question.
Oh, she finished? Okay. Is it okay to answer?
Sure.
Yep, go ahead with your answer.
Okay. I'm sorry. I just wanted to ask my first question, ma'am. I just wanted to verify. You said you were going to both be retiring March. I was writing as you were speaking, then you broke up. So I wasn't too sure. You said you were going to be oh, you're breaking up right now. Hello? Is she still there? Okay, I'm going to guess you were saying March of next year. That's what I'm thinking. And I'm going to guess based on what you were stating that both of you you have coverage right now. But my question was going to ask, are you still both working and have coverage through your employer group health plan? That was what I was trying to find out, but you were breaking up during your call.
I think we may have lost Deborah. I'll try to get her back as well. Her connection is we're losing her, but you can continue to answer that question, Jarita.
Okay, based on what I'm thinking she was stating, I'm guessing based on what she was stating was that they were both had the coverage and that they were both thinking of retiring. And when it comes to them both working and have coverage through their employer, all they would have to do if they're already on the rolls is let us know the month that they're going to be stopping work, and they can submit the special enrollment forms, which is what I mentioned in my presentation about the CMS 40B and the L564, which I have forwarded already to Mr. Hamilton, which he'll be able to share with the participants. Have one form completed by the personnel department, which would be that L564, and have the CMS 40B completed by the actual beneficiary. Submit both forms to us, and then we can have the coverage begin the next month after they retire, so there's no lapse in coverage. And like I said, if I'm wrong, then just have her email me and I'll be able to reply to her. I'm hoping that's what she was stating. I wasn't sure, but I'm hoping that was the answer.
Thanks, Jarita. Yes, we'll get that answer from Deborah as well.
Okay.
Next up, we have Jean from Bridgewater. Jean, can you hear us?
Yes, I can. Can you hear me?
Yes, we can.
Yeah.
Okay, great. My question is, I think somebody mentioned that the 2022 book is out, but what was lacking in the book was what are the premiums and deductibles going to be for 2022 for Medicare?
Hi, this is Thomas. Jean, thank you for that question. That information actually comes out after the book is published, so you're definitely right. And we don't yet have the numbers for 2022, but when we do get them, we can share them with the representative's office and be sure to share that with you.
Okay, thank you.
Absolutely.
Thanks, Jean. Let's go to Balvinder from Reddington. Balvinder, can you hear us?
Yes, I can.
ahead
My
with your
question is for the modified adjusted gross income, the 2-year look back that determines the extra you pay for Medicare. Is that determined each year?
Is it okay if I answer?
Yeah, please.
Okay. Okay. Pretty much each year, as you can see, we'll have the chart, which will pretty much tell you what the amounts are going to be on a yearly basis. So yes, each year we give you the Medicare Part B premium chart, and based on the IRMA and based on what category you fall in, if you happen to be that Medicare beneficiary, which has that higher income, we pretty much will go back 2 years. And like I said in the example, if we're missing, say, like I said, the example is 2020, we look at 2018. If we are missing that 2018, then we'll go back to your 2017 tax return.
Yeah, my question really was just that you're doing that each year. So you don't get, when you first start, you do a 2-year look back and that stays fixed forever.
Yeah.
You just do it
Yeah.
each year. Yeah, okay. Thank you.
Yeah.
Comes change.
Thanks both. Next up, we have Russ from Hillsborough. Russ, can you hear us?
Yes, I certainly can. And my question is very much like the previous one, and I think the answer was just given. I become eligible for Medicare a year from now, which will be November of 2022. So I think I heard correctly that my premium at that point in time would be based upon my 2020 modified AGI. Just want to confirm that.
Yes.
Okay, thank you very much.
Thanks, Russ. Next up, we have Lori from Millburn. Lori, can you hear us?
Yes, hi. I would have a question about enrollment for someone who is disabled, but who was eligible for Medicare Part B, but declined it last year and chose her spouse's plan instead. But now she wants to enroll. How does she do that? Is that form that you mentioned earlier? And how long does it take to process that form? And the third question is, once enrolled, does that also allow for enrollment into a supplement plan and a Part D prescription?
Now, my first question would be, since you said she enrolled, well, the person enrolled under Social Security Disability Insurance, correct? So normally how that works is after them being on disability for 24 months, they become eligible for Medicare automatically. Now, if they refused it, is there a reason why they refused it? I'm just trying to ask before I give an answer. Okay, go ahead.
Yes, there is a reason, because the spouse's plan was a good plan and the spouse was continuing to work. But now the spouse is no longer working, so.
Okay, so when the spouse decides to stop working, please have them contact Social Security so that we can look into them getting special enrollment for the spouse that had the coverage. And then we need to check into enrollment for the one who was receiving disability benefits who stopped it because of being enrolled on their husband's employment group health plan coverage. Because there's a policy that goes along with that. So I just want to make sure they have contact the office first, and then this way they'll be able to give them when it will be effective and what process they need to follow.
How does one contact the office? It seems like
You
I've been
can always,
for many days, and it just keeps putting me on hold for more than 45 minutes.
Yeah, That's what we're doing right now. Unfortunately, it's normally you call the office and you wait for someone to answer and they'll be able to service you, or you can shoot me an email. And then pretty much what I do, I don't take actual claims, but I forward the email to your local office and then have management assign it to someone to assist you. So if you're unable to get into the office, like I said, first, reach them by phone, give them a phone call, and see if you can get through phone. But if you're unable to do that, then you have my email information. You can shoot me an email and I will be able to forward the information to the local office as long as you provide the recipient's name, address, and phone number.
Thank you very much.
No personal information, so no social security numbers, no date of birth, just name, address, and phone number, and I'll be able to forward it to the local office for assistance.
Okay, thank you very much.
You're welcome.
Thanks, Lori. Next up, we have Andrea from Cranford. Andrea, can you hear us?
Yes, I can hear you. Can you hear me?
Yes, we can.
Okay, thank you very much. I have a question. I have a lot of elderly clients that lose their card and have not been able to get through to get a replacement card. My own mother has done the same thing. So is there an easier way, since Social Security is, not answering the phones, for these elderly people? Or is there a contact number that I can call to request the card to be sent to the client's address?
Online.
I was about to say my first thing would be everything that we're doing to help with replacement cards is by going online. So now my question is, have you created a My Social Security account? And so you can do everything online and have it sent to you within 30 days.
Okay, so these clients are elderly, and some of them don't even use computers. So they call me, they call the firm, and they ask, if we can help. So, I keep them on the phone and I try to call, and I haven't been able to get through. So that's why I'm asking this question.
Yeah, I'm about to say, then pretty much what we try to do is we try to connect you to the local office for assistance. And again, I just want to make sure everybody understands, due to the pandemic, the only way we're doing business right now is via phone. So I do understand that the lines can be overwhelming with phone calls, and we're doing our best to service the public. But like I said, if you're having difficulty, see if you can shoot me an email, and I will see what I can do about working with the local office to get some assistance.
Okay, I appreciate that. Thank you.
Thanks, Andrea. Let's go to Cheryl from Bound Brook. Cheryl, can you hear us?
Yes.
Go ahead with your question.
Okay. My question is, if you sign up for Part A only, and then you become hospitalized, are the drugs that you receive while you're in the hospital paid for under your Part A, even though you don't have a drug plan, Part B or whatever?
Hi, this is Thomas. Cheryl. Thanks for that question. I mean, it really becomes very specific as to the individual circumstances. So you can get your medications covered under Part A while hospitalized. But sometimes a medication may be considered kind of like more of an outpatient type treatment. So it really becomes case by case basis, and the type of medication that's being provided, if it's covered under Part B or Part D. So that's kind of a question that would need more particulars to answer sufficiently.
All right, thank you.
Absolutely, thank you.
Thanks, Cheryl. Next up, we have Elizabeth from Warren Township. Elizabeth, can you hear us?
Yes, I can. Thank you. I have a question. My father passed away recently, and I'm trying to help my mother sort through things. They had been enrolled in a Medicare Advantage plan, with one of the private insurers, but and my mother is billed for the monthly premiums, but then she just got her Social Security revised, survivor benefits, and the Social Security amount deducted for Medicare Part B and D premiums. And the amount looked very similar to the Medicare Advantage premium. Is Social Security deducting her premiums and then paying that private insurer, or is she somehow signed up for duplicate coverage? We can't seem to get an answer from anybody. We've been on the phone with Social Security extensively and with Medicare Advantage and the insurer, and neither of them have been able to give us a straight answer.
It's hard for me to provide an answer without someone looking into it. So I don't want to give any misinformation. So like I said,
Is that something that,
like I said,
yeah, is that something that happens? Does Social Security collect premiums to pay to Advantage plans? Or is it a
I'm not sure
coincidence?
about the Advantage plan part. Tom, I'm just asking Tom, when it comes to the Advantage plan, what we normally do is we collect for the Part B premium. So Mr. Bain, could you just cover the part about Advantage plans?
I wasn't aware of that, Jarita, but I'd have to look into it to confirm, but I wasn't aware of that.
Yeah. I know when you're receiving the benefits of Social Security, we automatically, once you start being eligible for Medicare coverage, we deduct the monthly premiums from your monthly benefit, to pay for the coverage. So that's what we do automatically on the Social Security part of it. But I don't want to say I know about the Medicare Advantage part. I don't want to answer to that because I'm not sure. So I know about the Part B, but I don't want to answer for Medicare Advantage because I don't know.
Right. So you're saying that Social Security would automatically deduct premiums for B, and she's got D deductions also, but that is for the traditional Medicare, not necessarily going to the Advantage plan. Like it's not being.
I'm not going to answer.
You're not answering.
Yeah, I just don't want to. I'm sorry. I don't want to give it misinformation because I'm not sure about Medicare Advantage. I don't really know that much about that portion. I can only speak on the Part A and the Part B and the enrollment and the Medicare premiums that we deduct for Part B. That part I can tell you about. Anything with Medicare Advantage, I would just forward that over to CMS to cover, but just to let you know.
To CMS. Okay. Okay. Thanks anyway.
Elizabeth, if you wouldn't mind dropping your email to me as well, I will forward this along to one of our caseworkers and they will reach out as well.
Oh, that would be great. Should I just put it in the chat or how should I?
Yeah, just message host. That's going to be me. And I'll forward your email address along.
Thanks so much.
Yeah,
appreciate it.
Absolutely.
All right. Bye.
Next up, we have Gail. Gail, can you hear us?
I can, but I'm not Gail. I'm her husband using her pad. Yeah, real quick. I really appreciate this webinar right now. Question I had is, I'm like the previous gentleman, become eligible May of next year, and I really know very little. So my first question is there a single source that would allow me to go and get far more detailed questions, particularly what's the best coverage if I anticipate high hospital bills, prescription medicine? Is there a guidance in how to select what you need other than A, B, maybe D, maybe a plan, and a little more detailed guidance? Is there a single source type of form I could access?
Hi, this is Thomas again, Gail's husband. Yeah, I think that what I would recommend to you is, so the public facing website from CMS is medicare.gov. So if you go there, you will find more information than you even knew you were curious about. And the second resource that I want to just mention again, that's been mentioned a couple of times, is the New Jersey SHIP program. So this is the State Health Insurance Assistance Program. And these are counselors that have no conflict of interest to assist people with their questions about Medicare. So you can do it over the phone. I don't think they're really doing in-person quite yet, but I'm not sure. And there is kind of a group in every county across New Jersey. So if you want to just do your own research, I would definitely recommend medicare.gov. The handbook that Adine and Jarita mentioned, even though you're not enrolled yet, you can see a PDF copy of that Medicare and You handbook online. It really does go through a lot of the information you'll want to know. And then I'll just make a plug for the New Jersey SHIP program once again.
Okay. Yeah, because there's a lot of advertising from United Healthcare and others about AARP approval. I just want, like you said, a non-conflict of interest opinion.
Exactly.
Thank you.
Absolutely.
Thanks, Gail's husband, and thanks, Tom. For our guests today, just want to confirm with you, are you guys okay going a little bit over? We have a lot of questions and we just want to answer as many as we can. Are you guys good to continue for another 15 minutes or so?
Okay, by me.
For our
another
guests,
15 is good.
Yes, please.
And do another 15.
Jarita,
We can do another 15.
Okay,
Can you hear
great.
me? We can do another
Yep.
15. Yeah.
Okay, we'll try to get to as many questions as we can. We do have a lot in the chat feature. Just a reminder to include your name and the town you are from. I see some people with their hands raised. Please first ask your question using the chat feature. I'm putting people in the queue and we'll get to as many as we can. Also, please message me, that's Nari Rep Tom Malinowski, the host of the chat. I will be the one queuing up those questions as well. All right, next up we have Christine from Cranford. Christine, can you hear us? Christine, do we have you? All right, that's all right. Let's move on. Bill from Reddington. Bill, can you hear us?
Yes, I can.
Go ahead with your question.
Do you hear me?
Yes, we can.
Okay, I am going to be 66 in January. I have not applied for Medicare because I am still an active employee of a large company and I have group health insurance. It's credible and all that stuff. And I did hear your comment in terms of the 2 forms that I would have to submit when I go for the special enrollment period. The question that I have is the IRS says, hey, look, if you're going to apply for Medicare, you can't be contributing to a health savings account. And what I'm also hearing is that they're going to look back 6 months. So can you explain why this is? I mean, I understand that Medicare is not a high deductible health plan, but if it doesn't take effect until I retire, why the need to look back 6 months?
Based on the information that we've been told, we would ask you to ask your tax professional for more information. So I can't speak for IRS, so I would suggest you contact them for more information.
Okay.
All right, thanks, Bill. Next up, we have Mike from Hillsborough. Mike, can you hear us?
Yes. Can you hear me?
Yes, we can. Go ahead with your question.
Thank you. Long time listener, first time caller. So I really do appreciate this. It was a great presentation. I've been doing some reading, downloaded the PDF of Medicare, and I've kind of lining up with what I want to do. My first question though is about the billing options. So I'm doing okay with my retirement plan. I plan to take Social Security at 66 and a half, but I also plan to enroll in Medicare for 65. So the first question I would have is, so what are my billing options in that case?
So when you turn 65, you'll be eligible as far as your Part A and Part B. If you are not receiving any benefits from Social Security, so if you haven't enrolled for retirement benefits as of yet, Center for Medicare Services, Medicare Services will bill you quarterly for the Part B premiums. Once you start receiving retirement benefits, then they will be deducted from your retirement benefit.
Okay, so it would be a quarterly bill, and that, which is fine. I can plan for that, and then to actually pay that bill, what would be my options to use a credit card or ACH, or what can I do? Bill, it could be credit card. It could be.
Mr. Bain.
Okay, a bank ACH.
Oh, Jarita, I think he's asking, so he's asking, you know, like how, okay, so Well, give me a minute to look into that, Michael, and I'll try to find out the answer. One second.
Yeah, and quarterly would be, the question I would have is, say it started on June 1st. So would the quarterly be, immediate? So it would be with that effective June 1st, but not, it wouldn't wait till the end of the quarter, it would be at the beginning of the quarter is kind of what I like. So that's very detailed, I know, but I'm
Yeah, because it's a little detailed there. And I'm pretty much
I'm
normally
pretty confident what I want to do. That's why. So I'm just trying to do my budget. That's all.
no problem. I understand. But I just want to verify, Tom, just to make sure I'm on the same page. I'm just verifying with you. CMS normally sends you a bill quarterly. So I'm just making sure I say this right, Tom. When they bill them quarterly, do they give them that portion where they can write a check or something to send back to CMS? I'm just verifying, Tom. I just want to make sure I'm saying this right.
Yeah. So what I've been, recently part of some of the presentations around how to pay, like there's more and more options now that are considering how to pay online kind of through my Medicare account. So I'm just trying to look up kind of the way that we did this before. And so
I'll tell you what, I don't want to put you on the spot because a lot of questions. So if I sent an email in,
yes, you can do that.
Are you fine with me?
Yeah.
Okay.
Yeah, and I'm just seeing it does have like this address where you can send the premium payments to. So we can give you all that information and describe how you can pay online versus mailing it in and all the things.
And could you repeat again, which email should I send that to just to follow up on?
Yeah, Adine, do you want to give your email address? It's in the PowerPoint slide, I know.
Absolutely. I will put it on the chat, Michael, and you can send it.
All right, that's perfect. Right. I did have two questions. The one thing that was I felt was missing today, and maybe I didn't hear it. I had some interruptions, but there was nothing really about Medigap itself. So there's Medicare Advantage. There was plenty covered on that, but I didn't really hear anything that was about Medigap coverage. And I'm an English major, so I'm a stickler for terms. So I know there's a difference between the two things. So I was wondering if there's any more information about Medigap coverage, because if one chooses not to do Medicare Advantage, Medigap could be a good solution to add for dental, let's say, or vision care.
It's a really good point, Michael, and I think Adine is going to answer. I just interrupted you, Adine. Go ahead.
No, what I was going to say is Medigap is really definitely something that it's an individual choice, but you absolutely should do some research before you decide to go with a Medicare policy instead of Medicare Advantage. So what that means is, where do you live? What exactly are they offering? And remember that you also have to have the original Medicare in order for you to have that. And other thing you should remember is you can't have both. You cannot have Medicare Advantage and a Medicare policy.
Understood. I'm playing my hand which way I'm going. So
right. So as soon as you do, I would say, Michael, the best rule would be you do the research and find out which one fits your needs better. And
correct. And I have done some. So what I'm curious about then is my best option to talk to the SHIP folks, New Jersey SHIP folks, about the Medigap plans in New Jersey?
Absolutely. We totally recommend that. You speak to them because they're amazing. And more importantly, they have one-on-one counseling.
Perfect.
Here, I cannot answer your question.
Yeah, I completely understand the position you're in. This has been a very nice presentation. The framework's great. I don't expect you to give me every answer possible. And
but the SHIP can.
Very good guy.
But the SHIP can, Michael. They will have one-on-one counseling, sit down with you, look up it, and find out what your needs are and try to find the best plan that can meet your needs. They can.
Perfect. All right. Thank you so much.
Welcome.
And Adine, a few people have asked about the link to SHIP. to NJ SHIP. Tom, I believe you mentioned it a few minutes ago, but would you mind just reiterating how people can reach out to them and contact them?
I will add that on the chat right now.
Okay, really appreciate it. Thank you.
You're welcome.
We have time for just about one more question. If we didn't get to your question today, I will provide a link at the end of this next question for you to reach out to us that way. But to close us off, here's Karen from Raritan. Karen, can you hear us?
Yes, I can. Thank you. And thank you very much for offering this to us today. I really appreciate it. I think my question is kind of related to the last caller. So I am on collecting Social Security and I'm on Medicare. My husband will turn 65 in February. So I know we have to sign him up now, but he is not on Social Security. So I'm not quite sure how this works. He'll get the Part A and B and whatever we sign up for, but then he's going to get billed separately. So there's no discounted rate or special billing that's already built into the coverage. I guess I just don't understand how that works. That'd be for him. I'm good. I'm fine for me, but not for him.
Okay. You said he's not going to be getting Social Security. So
no.
Is he self-employed? I'm just curious.
Yes, he is self-employed.
Okay.
And then
Okay.
I'm retired, and then we've been on my benefits, which I would like to keep.
And now my next question, when it comes to Medicare for the Part A to be free, he has to have been insured where he paid into the Social Security system. So you remember that portion of the presentation, correct?
Yes, and he has his entire life.
Okay, good. Okay.
Yeah.
So then pretty much like we said before, when it comes to the Part B premium, so we bill quarterly, and Mr. Bain explains about the procedures when it comes to being billed, and he'll be sharing that information.
Okay, so it's almost like a discounted rate already built in, and we just pay for it. Is that we pay the?
Sorry, I just don't understand the discounted rate part. What are we?
I guess I know, like when I get my Medicare, I pay just a certain amount into the rest of my coverage. So I guess I'm just making sure, like, even though he's not collecting Social Security, would he get the same rate as if he were? Maybe that's the better way to phrase it. And then he'd just get the bill for it separately.
I think I see what you're saying, but it might be better for us to do follow-up. So if you email Adine as well, we'll reach out to you just to walk you through that.
Okay. All right. I know I'm probably not explaining myself real well, but thank you.
No, I think I understood, but it's just probably easier to do it one-on-one.
Okay. Thanks.
Thanks, Karen.
Oh, thank you.
And thanks, everyone. I know we had a lot of many individual questions that we weren't able to get to today. If you do have a question for our office or any of our guests today, we are just asking that you reach out to us via the link I put in the chat feature just now. That's malinowski.house.gov/casework. We'll do our best to answer as many questions as we can. Again, thank you everyone for joining us on this call today. I'm going to turn it over to Adine and Jarita for some closing remarks.
I just like to say thank you everyone for participating in today's call. The questions were very great. I liked all the engagement. And like I said, at the end of the day, when the training is over, there will be some resources, Medicare resources shared with all of you, which will help you on your journey to enrolling in Medicare. But like I said, if you have any detailed questions, just shoot me an email and I'll do my best to assist you by forwarding you to your local office for assistance. Like I said, thank you all for having me and continue to be safe.
And what I would say is thank you for everyone that participated. It was a very large group and you had absolutely outstanding questions. You listened. It seems that you all definitely got something out of the presentation, which is great. Thank you for the Office of Rep. Malinowski for inviting us and giving us this opportunity to speak to you and get your questions. Don't forget that my email address is on the chat. So please feel free to email us any questions you have, follow-up questions, new questions, it doesn't matter. We are here to serve you. And the last thing that I will say again is please remember that this is the flu season. The flu shots, the COVID-19 vaccines, and the booster shots are available for you, for all eligible beneficiaries, I should say, at no cost to you. And again, we want to plug in the New Jersey SHIP. I put the information in the chat. Reach out to them. They will do one-on-one facilitating with you and give you any answers that you're looking for. Thank you for coming in. Thank you for your questions. That's it.